focus on COVID. A lot of focus on COVID and mandates for vaccines. And many of our agencies across the state, behavioral health agencies, are starting to put that plan into place. They're losing significant staff who don't want to get vaccinated. Some long-term staff, short-term, but really feel like they have to make this decision. Some of the issues they're really facing is for exemptions for medical and/or exemptions for religious. Several agencies are not even going to grant exemptions because they feel the threat to their residential facilities is so great that they can't allow that. So it's pretty concerted effort to really make sure that people are safe. I mean, some of our agencies are in counties that are a little bit more bent to the right side, I guess is one way to put it. And they're concerned about staff in there. And, so we have a mixed bag. Otherwise, there's a lot going on in the state with behavioral health and programs being rolled out. And a lot of exciting news there. But a lot of the focus today was pretty much on response to the COVID and the mandates that are coming down. And October 18th is the deadline for behavioral health agencies as part of that system to be mandated to have people on board. And what's really interesting is if you even got vaccinated now, you barely would meet that deadline. So it means they're going to have to go ahead and they're going to temporarily put people on administrative paid leave until they get that 2 weeks past the second vaccination. So very complex. So
a lot going on there.
Yeah.
Thanks for cluing us in.
Yep.
Ford Kessler.
The only update I have is a projected retirement date.
Which is?
Projected for November 1st, but we'll see.
So I guess that means we have to have a party next meeting. And I'm wondering if he'll wear his tie for that party, is my question.
No. No.
All right, then.
I might wear shorts and a t-shirt.
All right, well, that's proper retirement attire. Matt Reddy.
Hi, yeah, Matt Reddy. I'm one of the Jefferson Healthcare Hospital Commissioners, and I don't have anything new to report at the moment.
Thank you. Happy you're here. Commissioner Brotherton.
Yes, thank you. Greg Brotherton, County Commissioner, and I will, I guess, report that the Mill Road property that we've been looking at for the new landing pad for the campers at the fairgrounds, the appraisal came back and we're signing papers tomorrow and starting work, cutting in roads on Monday. So things are moving on that.
All right.
Good.
Progress. Lisa Thomas.
I almost said good morning. Also, good afternoon, everybody. Lisa Ray Thomas. I'm with the University of Washington Addictions, Drug and Alcohol Institute. And I guess a couple updates. We are hosting a virtual conference next week, re-energizing your team, how to use patient feedback and success stories, peer-to-peer learning, and how to do cross-sector sharing of that kind of information. And then the Behavioral Health Institute just opened up registration for their upcoming behavioral health conference called Reimagining Behavioral Health, Health Equity and Social Justice. And I'll put the link for that in the chat box.
Thank you. I'll try to get that into the notes when they go out so that everybody has that at their fingertips. It's always great to have some state perspective going on too at this table. We appreciate that you make the time to come to these meetings, Lisa.
And Ford, I'll believe you're retired when I see it with my own eyes.
Hear, hear. Chief McKern.
Chief Jim McKern, Quill Senior Fire Rescue from the South End.
Good to have you here. He's been a part of some good conversations that we've been having down in South County. Beth Meyer.
Well, hi, everybody. Beth Myers, Matt Care Navigator Coordinator at Jefferson Healthcare. I don't have anything new. It's pretty tense here, but we're pushing on.
Well, we appreciate that you were able to come today.
Thank you.
Dave Fortino.
Hi, Dave Fortino here, Jefferson County Sheriff's Office. Nothing new to report as of now.
Good to have you here. Gabby?
I'm Gabby Caudell with Believe in Recovery. I'm also the clinical supervisor of the residential program out at the jail. My new information is as of, let me get a calendar, 9/22, OPHS will be renting a unit from us at our building to provide services to people in Port Townsend 1 day a week. And so that will be on Wednesdays from 9 a.m. to 11:30 a.m. So they'll have space in Port Townsend, which has been a little bit of a struggle with making with the buses, getting people out to their clinic in Port Hadlock. Other than that, that's it. That's all I
Well,
have.
That's good news. Thanks, Gabby. Vicki Kirkpatrick.
Vicki Kirkpatrick, Director, Jefferson County Public Health for 2 more days. Ford, I'm going to beat you in retirement. My last day is tomorrow. And I'll let Apple, who I see is on here, give the update for the health department. But it's been a pleasure to work with you, and I'm so impressed with the work that you're doing.
Thank you, Vicki. And we wish you a really, really safe and adventurous retirement.
Thank you.
Adam.
Hello.
Hi there.
Not retiring yet, but, yeah, but
I'm shocked.
sorry, I couldn't help. I've just been outside, even outside of this meeting. I've done a lot of people are beginning to enjoy their retirement. I'm happy for them. I hope. Okay. Good luck, everybody. I hope you all have a great retirement. There's a lot of experienced people who are like, oh no, we're gonna have to figure out how to survive without them.
Yeah.
I'm just coming out of I just came out of a big training for database training last month, and working on making sure I haven't missed anything this while I was doing that, and finishing up certification there, and working on data for the PIMS.
Mm-hmm.
I finished that up this week. That's just going to stop there and say that, see what happens next week. So,
well, we're grateful you're not retiring, because we need that PIMS data, and I don't know who else can get it for us. And 2, I think we're going to mark this as the day that I have down as the first time Adam York made a joke at our meeting. So there. Brian Richardson.
Hello, Brian Richardson, Dot House Recovery Cafe. So the news here, of course, is implementing the new public health order to show proof of vaccination upon entry, because we are a food service establishment. For what it's worth, our members just seem glad that we're able to remain open in any capacity. Of course, there are some among our membership and volunteers who are not vaccinated, some who are not interested, and others who just have yet to get it. So we're sharing the resources available to folks, and doing our best. So we feel like we've got a pretty good system for how to track such things. And actually, I just want to say I'm really grateful for everybody at Public Health, because by making this blanket order, you've made our lives a lot easier, rather than having to follow sort of a patchwork of, yes, we have to get your vaccination, no, not yours, yes, yours. It's just everybody. It really makes our lives a lot easier and helps us feel safer. So I want to say thank you for that. It gives us cover, I guess, so to speak, for appealing to an authority outside of ourselves, so we can maintain a good relationship with our members and clients while you guys take the heat. So thank you for that. And we do feel safer for it, so I appreciate it.
Well, thanks for all that you're doing to implement it and to keep everybody safe. And good to have you here. I know you've got a lot on your plate. Chief Black?
Good afternoon, Brett Black, EJFR, and now Port Ludlow as well. New information, we are seeing a significant uptick in 911 transports for confirmed COVID positive patients, and that's impacting the workforce. We currently have some members in isolation as well. And I would like to echo Mr. Richardson's appreciation to public health for being definitive and decisive. And you have my sincere appreciation, especially when I read of all the horrible things that are being said to the public health workers and Dr. Berry. You have my sympathies and appreciation.
Thank you. Thank you. Denise Baker.
Hi, I'm Denise Banker, and I am with Jefferson County Public Health, and I am the coordinator for the Community Prevention and Wellness Initiative through the state. And we have 3 coalitions at Chimacum, Port Townsend, and now Quilcene. And our news is that we've just hired for our coordinator position in Quilcene, which makes us very happy, and we're looking forward to bringing on our new employee so we can get to work in preventing youth misuse of alcohol, tobacco, and other drugs in the Quilcene School District. Thank you.
That's great news. Thanks, Denise. Apple.
Hi, everyone. I'm Apple Martin. I am the incoming director at Jefferson County Public Health. Thanks for your notes of appreciation. It means a lot. It's been a very rough, especially 2 weeks, but we're going on 20 months of pretty much 7 days a week recruitment across our entire agency to mount our response to COVID. And we were very lucky in the many first phases or different phases of the pandemic, and that we had low numbers and certainly low death rate. That is, of course, changed, which I'm sure you all are tracking. It's pretty scary, and we are feeling it deeply here at Public Health. We definitely don't get a rest. We're all very committed. We are changing some of our workflow algorithms to be sustainable, even though the surge is at its peak for us ever, because we just can't tolerate this long of a sustained mounting to do the work, the fine and expert work that we do. We are still doing great work, but we have to start triaging. And Dr. Berry's been a really clear and motivating force to support us. We really appreciate her. We miss Dr. Locke, and we wish him well. I think he's probably having a great retirement. He started this cascade, and we're in a little bit of a grieving period because Vicki is leaving. It's been actually a particularly tough day today as we had some of our last staff meetings with her present. And I am taking a daunting, a daunting plunge into this new role at this unusual time for public health. And our department is clipping along. So we are doing a lot of things that we normally do, but we're also all hands on deck here. And we pretty much, many of us do COVID all day, every day, despite the grants that we do need to be doing as well. Our clinical services are going through the roof. We have full schedules for weeks at a time now. Our school-based health centers are up and going, and we're just really doing a lot across the districts. I'd like to make a plug for the work I've had the fortunate ability to do with the school districts and the superintendents in preparation for this year's school and in-person learning. I deposited my kid at school the other day for the first time this year, and it's really different with everybody on campus, but I have deep confidence in the districts and the superintendents. They've worked very closely with us all through the summer in preparation for this different school year. I think I'll leave it at that. There's a lot to say, but I appreciate the time to share with it. We appreciate your community and collaboration with all that we're trying to do.
Well, I would say that every one of the agencies that are at this table are experiencing some impacts. I hear it from Chief Black and from Public Health and from the hospital. And I'm grateful, one, that you've all made time to be at this table and that we can all be here in support of each other, even when we're not able to be at the table. Brian Gleason.
Hi there, Brian Gleason, Jefferson County District Court, here for Behavioral Health Court. Our only update is expect an email from us. We finally have someone that's ready to graduate next month in October. So we'll send out that invite to anybody who wants to appear for that graduation via Zoom. It'll also be live streamed on YouTube, and I'll include that link as well.
Thank you, Brian. Cherish Cronmiller.
Hi, everyone. Sorry you can't see my face. I'm driving from Forks back to our PA office. As some of you might be aware, DSHS is sort of changing their location in Forks as to, like, you know, who they have coming in and things like that. They're down to, I think, like one cubicle there. So we've had to move our Forks office. We've moved from the DSHS building over to next to the PUD building. So there's Vision Care and the Fish and Wildlife Conservation or Salmon Coalition. I'm sure I'm butchering that. But anyways, that's where we're at right now with 71 South Park Spartan. We're not officially, you know, our doors aren't open, but that's going to be a location that we'll set up for people to be able to do drop-offs or, you know, see our staff if they need to do a face-to-face. Not much else to report. We still have plenty of rent assistance money. Don't listen to anyone that says otherwise. We've got rent assistance money in Jefferson County, and we have it from a couple of different pots of money. So if somebody wasn't eligible before, I encourage them to look at the criteria again at our website. All of our forms are available there. So if you are helping somebody to complete documentation, those forms are at our website. We have links to the Commerce site that has some documentation in other languages if that's necessary. Of course, we're happy to also assist with that if need be. So, and you know, I'm thankful of the public health. I issued a mandate for our agency. Everyone has to be vaccinated by the 18th, and I've had 3 uncomfortable conversations the past 2 days of people claiming religious exemptions that clearly aren't religious exemptions, they're personal beliefs. But legally, not everyone understands those fine lines, and so it's a challenging place to be. And you know, if any of you need support in that realm, I'm happy to provide what limited guidance I might have, or any of our forms or information that, you know, I've sent out to our staff. So, and yeah, thanks.
Thank you, and thank you for including us on your drive. I think I've gotten everybody. Is there anybody who I've missed in the course of introductions? All right. I am going to turn it over to Molly Martin. Let me just find the right. I'm going to share my screen. Hold on one second. Can you folks see the presentation? Is that a yes or no? Of course, now I'm trying to see you guys. Thanks for bearing with me.
Yes, we can see it.
Okay, great. So you may remember before the pandemic, some of the big news that we were excited about and watching how events were unfolding had to do with the Sequim Healing Campus. And I thought it would be great to have somebody from there come and give us an update as to what is going on, what their progress is there. And Molly graciously agreed to fit this into her very busy schedule. And so Molly, I'm going to turn it over to you.
Absolutely, thank you. So I'm going to dive right in here and talk about our healing clinic and kind of the phase that we're in currently. It seems like we're rewinding a couple of years now, and maybe we can rewind to before COVID. But when we were talking about this previously, we had talked about a multi-phase plan to roll out the healing clinic, which will include an opiate treatment program. And we are in the process of building a 15,000 square foot facility that has already been zoned for healthcare and is actually right kind of behind the Costco in Sequim, although you can't actually see it from Costco. But the building is coming along very nicely, and we are on schedule to be able to open here in early 2022. We expect to be able to accommodate up to 250 patients within Jefferson and Clallam County. And I'll go into a little bit more detail about what type of care they'll be getting here soon. And we'll have an estimated 40 to 50 employees who will be working at the healing clinic, although that may change a bit depending on staffing demands as well. And we will be implementing a kind of a ramp up period. So we're not going to start off on day one with 250 patients, but we will be starting a phased ramp up to be able to meet community demand. All right, we can go to the next slide there. Perfect. Okay, so this picture was taken just, I believe, a few weeks ago now. And so you can see the building is coming along quite nicely. The roof went on last week. We're putting up siding this week. Landscaping is going in. Like it's really, things are starting to fall into place. And we're hopeful that we'll actually be moving in furniture and staff and things like that sometime around middle to end of January timeframe, but then that will allow us time to actually work on training staff, work out any kinks and things like that before we bring in patients likely around March. Okay, so I've heard a lot of questions from people across the counties regarding recruitment plans, because this is a lot of skilled professionals to be working within the walls of one clinic. And we are currently recruiting for several different roles, or we will begin recruiting for several different roles, I should say, within the next few weeks. We do have a recruitment strategy that involves a lot of out of area recruitment. We're hopeful to bring in some new professionals and not just have people bouncing around from organization to organization who are already working here. We want to add to the community. And so if you know of somebody who is from out of area or wanting to move to lovely Sequim and fits within one of these roles, we'll definitely be wanting to talk with a lot of people to fill many different roles here. And as you can see, some of these are roles that have to focus more on like the substance use disorder side, but we also have roles that will focus on case management as well as primary care. So if we go to the next slide, I think that's where I've got kind of our breakdown here. Yes. So we'll be offering a lot of different services. You know, the big one that's been, of course, thought negatively of by some members of our community has to do with the daily dosing of methadone or other medicines for substance use disorders. But that's only going to be a portion of what we do. We're not just going to be a dose and go and send people on their way. They are going to get total holistic treatment from us, and they'll get an individualized treatment plan that seeks to address total patient care, not just their substance use disorder. We'll have behavioral health services on site that include outpatient psychiatric care as well as medication management. And then, of course, counseling both one-on-one and in groups for behavioral health disorders. And then we'll have substance use disorder counseling one-on-one and groups as well. Primary care, which is my background is in primary care as well as addiction medicine. And primary care is just where I'm very passionate about. And I think that if to focus on our patient population, we have to address their primary care needs and their total health. So we will be offering everything from just, you know, like routine physicals, getting people up to date on preventative health care, their pap smears, their immunizations, things like that. But we'll also be seeing them for chronic disease management and episodic care. So a lot of patients come in they haven't had regular primary care in a very long time. And so we can help get their cardiac conditions under control. We can help manage any other chronic diseases that they may have, And then also address, the lumps, bumps, scrapes, abscesses, things like that, that they may need to address on like a more urgent basis. We'll have dental care on site as well. Dental care is probably going to be more of a part-time initially on site, but we will have at least 3 days a week where we're able to provide both restorative dental treatment as well as preventative dental care. We'll have case management, both for chronic disease management and for substance use disorders. And so we'll have potentially a social worker as well as a nurse case manager. We'll have child watch on site, which will allow those who are seeking treatment from us to leave their children in the child watch area for up to 2 hours while they're in the treatment facility, but the parents do have to remain on site. They can't, leave their kid and then go to Costco. Will be it's strictly for while they're here getting treatment with us. We'll provide shuttle transportation for residents of Clallam and Jefferson counties if they don't have other means of transportation. And then we'll also do a lot of extensive care coordination with other local agencies and resources to ensure that our patients are getting all of the services that they may need that are available within the counties. And let's see. We do have to have a safety plan in place, which tends to be the thing that a lot of people who are not familiar with OTPs are in the community have been questioning us about. I'm sure most all of you are familiar with the safety plan and safety plans in theory. So I won't go into it in too much detail, but we've been doing a lot of coordination with local law enforcement and community leaders. We'll have an on-site security team as well as very strict systems and protocols for keeping our patients and our staff safe. All of our staff will receive specific safety training applicable to their positions, but also applicable across the organization. We will have patient education and patient agreements to detail out what our safety plans are, as well as means to help patients understand the expectations that they can have of us and the expectations that we have of them when they're on our facility. And then we also feel that the gradual increase in the patient load that we're planning on will help us make adjustments in real time to whatever safety issues we may encounter, work out any kinks, and address other facilities issues or training. Okay. All right. And Lori had asked sort of what this group could do to help support us in this journey. And I think that for us, really a lot has to do more with the support and advocacy that we've already received from the healthcare and behavioral health professionals within Jefferson County, and how outspoken so many of you have been in there being a need for this in the community. There seems to still be the inaccurate assumption among some community members that we're going to be bringing in people from other counties or other parts of the state to get the type of treatment that we'll be offering. And that's just not the case. And so I think the ongoing voice of professionals like yourselves to be able to say that, no, we really have a problem here in our community, and that's who we're going to be seeing and who we'll be taking care of. And then also continuing all of us as professionals to address the stigma in our communities that surround substance use disorders. We want people unashamed to walk through our doors and to seek care. And until we actually get rid of some of the stigma that's within the community, I think that that's still going to be a big barrier to care for a lot of the people who we could potentially be helping. All right. Now, does anybody have any questions?
I'm really grateful that Molly could come here because we, oh, I'm sorry, Chief Black.
I didn't mean to cut you off. I'm sorry, Lori.
Go ahead.
Yeah, I just wanted to say, wow. I had no idea this was, flowering right next door to us here in Jefferson County. So I'm pretty optimistic about this opportunity. And you may not know this, but East Jefferson Fire transports most of the mental and substance abuse patients out of Jefferson Healthcare's facility. And right now we're, going across the pond or even farther. So this is a great new asset to the community. Once you open, if possible, I'm hoping I could invite myself and maybe a couple staff to tour the facility to kind of learn the layout and your procedures for check-in and whatnot.
Of course, absolutely.
Yeah.
And we have a kind of a tentative plan in place for sometime in January or February to do something for like law enforcement, fire, all first responders, to help them get a better understanding of what we're doing as well, and to also show you some of the things that patients may come away from our facility with, like the methadone carries that they may have and things along those lines, so that you're familiar with it, as well as familiar with kind of the after hours protocol that we will have, that where you guys can contact us if there is an issue with one of our patients. So I am happy to, I think my email is somewhere on here, but I'm happy to get in contact with you and add you to that list as well.
We'll make sure your contact information gets in the notes for this meeting.
Great, thank you.
Beth, did you have a question?
Yeah, I wasn't clear if there's inpatient beds or just outpatient treatment.
It's currently outpatient treatment 6 days a week.
Okay.
And the phase 2 that we are hopeful to be able to fund with in the next couple of years will also include inpatient mental health beds. So building a small inpatient mental health facility.
Thank you so much.
Other questions for Molly?
I just have a comment. I was on a call today where I heard at this stage of this year, we've had 2,000 overdose deaths in the state of Washington, which is almost double what it was last year. And most of those deaths are attributed to fentanyl right now. So it's a pretty drastic situation out there. And obviously having more services or access to services hopefully could stem some of that tide and be helpful. And probably the problem with the fentanyl right now is most of it is not being injected. It looks like it's being smoked or in pill form. And that's why we're not catching it in any of the syringe exchanges either. So kind of interesting news. So.
Yes. And thanks, Beth, for putting the average 128 overdose deaths daily in the US. It's sobering information. So one of the reasons why I asked Molly to come here was back at the beginning of this group coming to a table was when there was even the idea of having a healing campus, and money was being sought to put that in place and to start this process. And our group was coming together to talk about what are we going to do about crisis stabilization in our own county. So it's good to see that over the process, we've got something that's coming forward. Brent Simkowski from Jamestown wrote us a really kind and supportive letter when we applied for the grant that funds the work that we do at this table. And so we really do want to, in return, do whatever we can, whether it's individually or collectively, to speak up around stigma where there's opportunity, to speak positively about the services that are going to be there, and as Molly said, to indicate that the need really is here on the Olympic Peninsula. It's not about bringing in people from any other county or any other areas. Any other questions for Molly before we move on? All right, Molly, thank you so much. You are welcome to stay, but if you have things to get to, we totally understand.
I think I'll go ahead and sign off, but thank you all for having me.
All right, bye-bye.
Take care. Bye.
Okay, I'm going to share my screen again and we'll move on. I wanted to talk a little bit about RCORP grant updates, because this month is the month of every report on Earth seemingly being due to them. We have a sustainability plan, which is something that we do each year of the grant that we have. So that's a significant thing that I'm submitting a draft of next Friday. I wanted to show you that we had done a survey, which I clicked the link to so that you can see sort of the answers that we got from everybody and how the information there is going to be what goes into the final sustainability plan, or the plan that we come up with to address what you folks talked about in the self-assessment. Then we also have data that is due this month. There is both the data, the PIMS report data, which I know I've got Believe in Recovery, DBH, the hospital emergency department with Adam, and Safe Harbor. They're all pulling together some very specific spreadsheets. And then I'll be coming out to the rest of you folks for the regular data that we've been collecting, every 3 to 6 months. I think now we've moved to a 6-month cadence to sort of compare, give ourselves sort of a longevity. This is what our numbers look like over time in terms of encounters that we're having with both mental health and SUD folks in our community, whether it's law enforcement, emergency department, or EMS services. And the last time that we talked, and I've included a link to the last data review that we had in case anybody wants to spend time, which I know you all have, to look at that. We talked about the idea that we'd like to work some more on our data standardization, which we've done some work toward since the last time. I think we last talked about this in March of 2021. And then we'll be looking at how we can quantify some of those missed opportunities. And of course, there's a lot of change that's happened legislatively that's changed our landscape. So how that's impacting who we're connecting with or who we aren't. And then to do, perhaps, I don't know if we'll have enough data, but perhaps at this milestone, we'll be able to drill down a bit on the impacts of COVID. So those are all things that we're looking at as we pull in your data this month, and should spin back out to you. I'm thinking it's October that we'll come back to you with the results and do an overview, as we've done a couple of times a year here since we've been meeting. Is there any questions on that? I know that the folks who have the PIMS report data, I know that they're all working on it. I know I owe Gabby a call. And I'm going to send out emails to the rest of you folks that are on this list with what you sent us last time for your agency data to see if we can spin that around by next Friday. Any questions on that? All right. I wanted to talk a little bit about what we're calling a pre-hospital behavioral health summit. This is something that came up at a South County harm reduction conversation that the Behavioral Health Consortium hosts a table down in South County with, we have Chief McKern and Sheriff Knoll and Greg Brotherton's there, people from the school district. There's some key community leadership down there in the South County area who's been working with us to figure out how we might address naloxone availability and distribution. And one of the conversations that came up was just this, how we are dealing with the changes in our landscape that impact how we work with our behavioral health patients out in the field for the various agencies. And so Dr. Karlbaum, who also attends that meeting, he is the medical, I want to say medical director for the EMS. Chief Black can correct me if I've got his title wrong. But anyways, he suggested that perhaps we bring some of these key agencies together to sort of work through what it is that we're encountering as we sort of try to deal with the changes and how we can make it better and more smooth, and everybody's acting within the new legal boundaries that we have. Our vision is that we understand those boundaries and that we're working together even better than we are currently as we move through having those folks at the table. And I'm interested, Chief McKern, I know you're on here. At the end of that meeting, you gave us a story that talked a little bit about why it was really important that we do this. It seemed like it was something that had happened in Mason County. And I wondered if you remember what that was and if you could share that with this group.
Oh, absolutely, can share. Mason County had the unfortunate story I left at the end of it. And what happened to those folks is that early on, probably about a month ago, they had a suicidal patient in the Belfair area. And unfortunately, Law enforcement got called to check on him. They didn't go. They said they weren't going to go. And unfortunately, fire did not get the call. They did get the call about 3 hours later, and it was for recovery. So those kinds of things we don't want to happen here. And so that's what triggered this behavioral health summit to get together, and we can start having the players to the table like we just talked. So that's what that's all about.
Thank you. Jim Novelli, who sort of brings he and his team bring the DCR aspect into this, that might be something that we can integrate more fully in how we deal with this across our county. I'm interested I see that we don't have any law enforcement folks on this call, but I'm eager to get the Port Townsend Police Department, whoever is appropriate from Chief Olson's perspective, involved in this. And I've already started a conversation with Sheriff Knoll. I'm interested if there are any feedback, any ideas from folks as you hear about this effort that we're planning. We're looking at October 27th, so we've got some time to really plan something that's useful to the groups to begin with. I'm trying to find my screen where I can see everybody. Is there any thoughts or feedback or perspective that you'd like to make sure we think about as we plan this summit?
Lori, this is Greg. I think this looks great. And I don't know, I'll reach out to the Chief Olson. I think having both law enforcement agencies there would be great. And, you know, with the campground moving from the fairgrounds in the city into the county, we have a real world example of some of the handoffs that are happening right now. And I would love to have that as a case study explored by the Port Townsend Police and the Sheriff's Office. So I will, I'll advocate for this to the law enforcement agencies.
Well, thank you. Thank you. That would be great. And you're right that what we had in terms of the fairgrounds is going to be evolving here as time goes forward, and we're going to have county dealing with what the city has been dealing with, if I have that right. So that is an interesting point to be considering as we get together and talk as a group. Any other thoughts on that before I move on? So quickly, this is just the realm of projects.
Lori.
Yes.
I'm sorry, I can never get to my unmute button quickly enough. So this is Lisa again, and as Lori said, I sort of bring a state perspective to the table, and I think this is really exciting, innovative, fabulous, and collaborative what you're doing, and I hope I can participate. And I know that other jurisdictions across the state would be really interested to see this model and implement it in their jurisdictions too, because this is an issue everywhere. And thank you all for what you're doing.
Thanks, Lisa. We know that I have checked around trying to see if I could find a roadmap of people who had done this successfully. So we do realize that we're a bit stepping out and hoping that the ground will rise up underneath us. But the cool thing about this community and the leaders of the agencies in this community is they are people who talk to each other, and they are people who work it out. And we've worked out things before, and adjusting to this new landscape, I think, is something that is well within the wheelhouse of every one of those people and their teams that are going to be at that table. Okay, moving on. On the projects front, I'm just showing a list of projects that are all things that this group is doing at some level or another concurrently. And I'm noting that we have added both the funding for the Pfeiffer House that we're looking at and considering, and I plan to bring back to you, or have Kelly Parcher bring back to you, some proposed approach at our next meeting, as well as this summit. So these are things that we're adding to the table. This summit is definitely us acting as a convening table for Dr. Carl Baum and the East Jefferson Fire and Rescue's idea. And so we're grateful that we have this table to convene it at, and that we've got leadership like Dr. Carl Baum, who is sort of anchoring the gathering that we have here. So I'm going to be adding that to the work plan that we're submitting an update of here to HRSA back in Washington, D.C. on September 30th. As I say that, one of the things back on this one is executing this communication, education, integration effort around stigma. And a couple of key things that we have done in the past couple of months. And when I say we, I include Denise Banker and everything that she and her team are doing on the social media front around prevention, as well as some other key things that we put forward. We've got a fentanyl and naloxone awareness campaign that's running on social media platforms right now. Really appreciate public health's support in terms of talent in pulling that campaign together. We got the content and they helped us put it together in something that looks pretty professional. One of the things that was noted when I brought this up at my Washington, DC meeting, I have a coaching group that meets with me to see what we're doing each month. And one of the things that they suggested that I haven't done that I realize I need to do is for every one of these posts that we put out there, we need to include phone numbers of the various agencies in our community where folks can go to get services to help with substance use disorder challenges. So note that that's something I'm going to be adding. I'll be reaching out to Safe Harbor, Believe in Recovery, DBH, and the hospital to find out exactly where you'd like us to direct folks to, and probably Recovery Cafe, these places that folks can go to get support. And we'll start including that in the communications that we're doing out there. And hopefully that is one way of showing us as a collective that's really supporting our community. And then I wanted to specifically call out, oops, now I've gone. Thank you for your patience. There we go. I wanted to call out, so on the 31st, August 31st was the International Overdose Awareness Day. And we had 3 different videos that you might have seen. The front picture of each of them looked like these 3 things. They were about 17 seconds. They ran, we boosted the post, which just means it got out to more people. And they went on both Facebook and Instagram. And we got some stats around what sort of through plays our money got us. And I'm never sure how accurate that is, but I wanted to compare that, what we were getting with the social media data in terms of who we reached when we did boost a post versus when we don't boost a post. So I'll come back to you with more insight there, but know that this campaign run and you all get credit for having been a part of making sure that got out there with the funding that came with this grant. And then quickly, were there any questions on any of those communication? All right, I can tell this is scintillating. One of the other projects we have to do that we had on our list of things that is sort of slipped and slipped and slipped in terms of our bandwidth, I think, to even deal with it, is a bi-directional means to communicate with each other about specific patients. And that is going to require some sort of a platform that those providers are a part of. And OCH has a survey that they've been asking for people to participate in. And now I'm looking at this and wondering if I have the right link here. One is to the community exchange information, and they're interested in getting feedback from each organization and are willing to pay for it. So I welcome you folks clicking on that link and supporting OCH as they gather data, because in the end, it's data that will help us as we here in Jefferson County decide what our next steps are. Harm reduction, as I talked about, we've been meeting regularly once a month. Right now, where Lori Tinker, who was a part of the group representing Jefferson Healthcare, she has retired, and I'm not sure who will replace her. We're also waiting on insight as to whether we'll be able to use the Quilcene clinic that Jefferson Healthcare has down in that area to function as a receiver of the naloxone and a distribution location. So those are some things that we have on the table, and we are meeting again this month on the 21st of September. Any questions around that? All right. Finally, potential funding opportunities that are out there. There are some that I track. If there are ones that you are aware of, I invite you to send them on my way. One of the things that we are trying to do as a community, and I admit I haven't gotten very far on it this month, but next month I hope to pick it up with some fervor, is to create a collective overview of the various places that we have funding to interact with or to move justice involved folks toward the services that they might need around substance use disorder. So this is a very tiny, tiny graph, I know, but I've been reaching out to different folks in the agencies that sit at this table, agencies and providers, to see what grants you have and to hopefully reveal what gaps we have that we should be very directed in pursuing funding for. And this is a bit of a tall order because one, because everybody is really busy, and two, it's not intuitive for, I think, everybody to share sort of what grants they're going after. And so I know that this might be a kind of new model that we're looking at, to look at a collective overview of what we have as a county on this particular landscape. But I appreciate those of you who are willing to share with me, and I'm kind of opening up the floor to conversation if there's somebody who would like to give feedback or say why they love the idea or why you hate the idea.
Lori, I want to commend the idea because I think that that's part of what collaboration is. And maybe we aren't used to sharing the information about what grants we're applying for. But it actually, I think, would be really helpful for all of us in knowing that this is a unified effort to affect change for substance use disorder folks.
Thanks, Denise. Anyone else?
I second that.
Yeah, I look for my support and behind Denise. You know, I find in almost every sector, it's about tactics or strategy, and I think that we can come up with strategy if we work together and are able to share this information, so we can, you know, get the best outcomes for our residents. That's really the ultimate goal. So that's good.
And I think if we can all know what the other is going after, we might actually see opportunities where we can collaborate towards something together that a unified approach might be more successful than an individual. And I know right now I'm only thinking Jefferson County, but if there are places beyond that you think I should be thinking about in terms of pairing up with Clallam or something, you know, I hope people feel welcome to bring those ideas to the table as well.
Well, Lori, the coalitions are definitely pairing up with Clallam and Kitsap in terms of the work that we do and the coordinators in those counties. So that's something that we could also bring to this table so that we can broaden our partnerships and our collaborations.
I'm particularly hopeful as we think about EMS and our challenges with transport. You know, Chief Black was talking about challenges even with COVID patients and the increasing load that's happening there, that we might be able to think creatively, you know, how we can band together to help make sure that we've got the personnel or we've got the option so that we're not tying up EMS in a way, you know, that doesn't benefit our community. If we've got a fire and somebody's off to Seattle with, you know, the equipment that we need, we want to do whatever we can to make sure we're not caught in that position. Okay, I think that is the end of what I brought to you or what I have to bring to you. Are there any other closing insights or things that you'd like to say? We're wishing Vicki a very happy retirement. Anything else for the good of the order? Jim.
I have an announcement to make, and Ford is retiring. We're going to let him go on November 1st, maybe. That's a wishful thought, I think, on his part. But when Ford leaves, he's leaving behind a legacy of great service to community and a great team. I want to assure you that team is not going to disappear. That service is not disappear. We have reached an agreement in principle. Ford's agency, Safe Harbor, will become part of DBH. And we will be offering the full services under one roof of substance use disorder services, mental health, MAT, one-stop shopping. So I really appreciate the collaboration. It's taken a year. We've been dancing for a while. He's one hell of a dance partner. And I'm really excited about this opportunity. I should give Ford the floor. He wanted me to announce it. I gave him the opportunity, but.
One of the things I'll say is we've already started the collaboration. We've been working together with the MAT program and doing some other things together. So this is just a viable solution to what we need to do to help bring some more services and quality services to this community. So I'm grateful for everything I've been able to do over the years, and it's nice to pass it on to someone else that's got the energy for it. Mine is waning. So, thanks.
At least I know where you live. You're not going to escape that easy. So,
Well, I think this is cause for celebration. Ford, I hope we've got you for one more meeting. We'll look forward to, as things unfold, we'll keep everybody up to date at this table. Anything else before we take off a tiny bit early? All right, well, everybody go off, have a great rest of the day and weekend, and we'll look forward to seeing you next time. Bye-bye.